Hello everyone. We will start with the new chapter of Pharmaceutics-II, that is ophthalmic preparations. So ophthalmic preparations are the preparations or the formulations which are used to treat the different diseases of the eyes, or which are used to diagnose the different ophthalmic diseases, or to give the symptomatic relief from the different ophthalmic diseases are nothing but ophthalmic preparations. So which are the purpose of use of these ophthalmic preparations? First one is they are used for the treatment of diseases of the eyes. Okay, ophthalmic preparations which are used for the eyes. So they are used for the treatment of different diseases of the eyes, like the dry eyes, then conjunctivitis, color blindness, glaucoma, cataract. Okay, so these are the different diseases of the eyes, and the drugs like antibacterial drugs, antifungal, antiviral, then anti-inflammatory drugs. These are used to treat the different diseases of the eyes. So in that, the antibacterial drugs like neomycin, then bacitracin, polymyxin B, ciprofloxacin are used. Again, the antiviral drugs like idoxuridine, acyclovir, famiciclovir. Then antifungal drugs like amphotericin B, natamycin, miconazole, ketoconazole and fluconazole are used. Then different anti-inflammatory drugs are used to relieve the inflammation of eyes, or which are used in the treatment of conjunctivitis, like the drugs like ketorolac, nepafenac, flubiprofen, diclofenac, then bromfenac. These are different anti-inflammatory or non-steroidal anti-inflammatory drugs are used. Again, certain formulations or drugs are also used for the symptomatic release of symptoms. Okay, so different diseases shows the different symptoms like irritation, then redness of the eyes, inflammation or dryness of the eyes. In that, again, the different anti-inflammatory drugs are used, or different lubricating drugs like HPMC or hyaluronate are used to keep the eyes moistened or to relieve the redness or irritation of the eyes. Again, for the diagnostic purpose, different diagnostic agents are used to diagnose the different disease condition of the eyes like cataract, glaucoma. Then as aid to surgical procedures. Okay, so different mydriatics drugs or cycloplegic drugs like adrenaline, then phenylephrine, tropicamide are used to aid the different surgical procedure or to make the surgical procedures easier. Okay, so what is meant by mydriasis? Mydriasis is nothing but the dilatation of pupils, or the pupils of eyes get dilated or enlarged, so that the diagnosis of the eyes made easier. Also different surgical procedures are made easier. So for these purposes, different ophthalmic drugs or different ophthalmic preparations are used. The next one is how we can define the ophthalmic products. Ophthalmic products are the sterile products meant for installation into the eye in the space between eyelid and the eyeball. Okay, you can see here in the diagram the different parts of eyes. Also, you are studied in the human anatomy subject, the anatomy of eyes. Okay, So here it is an eyeball and eyelid. So the different ophthalmic products like eye drop, eye ointments, eye suspension, which are instilled in the space between the eyelid and eyeball. So these products must be sterile and are prepared under the same condition and by the same method as other parenteral preparations. All of you know that ophthalmic preparation are the sterile preparation, means what? They should be free from any type of contaminants, any type of microorganisms and the pyrogens. As eyes, these are the delicate organs. Okay. So to avoid any adverse or toxic effect to the eyes, our ophthalmic preparation should be sterile, that is they should be free from all types of microorganisms. So same care is taken while preparing the ophthalmic preparation as that of the parenteral preparation. आपण parenteral preparations तयार करत असताना जी कोणती केअर घेतोय किंवा त्याची स्टॅबिलिटी मेंटेन करण्यासाठी ज्या कोणत्या प्रोसिजर आपण फॉलो करतोय, सेम कंडिशन्स आपण ऑप्थॅल्मिक प्रिपरेशनसाठी सुद्धा मेंटेन करायचे आहेत टू मेंटेन द स्टरिलिटी ऑफ द ऑप्थॅल्मिक प्रिपरेशन्स. सो विच आर द डिफरंट ऑप्थॅल्मिक प्रोडक्ट्स according to their physical form? They are categorized in different categories like eye drops, then eye lotions, eye ointments, eye suspension and the contact lens solution. These are the 5 types of ophthalmic preparation. Again, in that preparations the different types of drugs are incorporated according to their need. Okay, so in that the liquid preparations for application to the surface of the eye, such as eye drops and the eye lotion. Eye drops and eye lotion, these are the liquid preparation which are applied to the surface of eyes. Again, the semi-solid preparations such as eye ointments, creams and gels for application to the margin of the eyelid and for introduction into the conjunctival sac. Again, the semi-solid preparations like eye ointments, then gels or creams, they are applied at the margin of eyelid. Okay, all of you know the margin of eyelid. In that place, these semi-solid ophthalmic preparations are applied, or also they are introduced into the conjunctival sac. Again, the solid preparations like ocular inserts intended to be placed in contact with the surface of eye to produce modified release of medicament over a prolonged period. Okay. Again, it is a novel concept, or it is a novel dosage form which are used for the eyes, that is ocular insert. These are the solid ophthalmic preparation. They are just placed in the eyes and they gives the prolonged release of drug. Then parenteral products for subconjunctival or intraocular injection. Certain injections are also prepared for the ophthalmic use, or they are directly injected at the subconjunctival or the intraocular sites. Then liquid products for irrigation of the eye during the surgical procedures. To clean the eyes, the different irrigating solutions are used, which are generally used while doing the different surgical procedure or after surgical procedures. So all the ophthalmic products are required to be sterile and free from extraneous particulate matter, and solutions used during surgery should not contain any preservative. Okay, so as I said, ophthalmic preparation should be sterile also. They should be free from any type of foreign particulate matter to avoid the infection and irritation of the eyes. So which are the different basic requirements of these ophthalmic preparations? Okay, or which are the different ideal qualities of these all ophthalmic preparations? So ophthalmic preparations should possess the following properties. First one is they should be free from foreign particles. Again, they should have a adequate viscosity. Then third one is the tonicity, means they should be isotonic. Then fourth one is the pH of preparations. Then fifth one is the sterility, and sixth one is the surface activity. Okay, so we will discuss in detail about all these points. First one is the foreign particles. As I said, ophthalmic preparation should be free from any type of extraneous or the foreign particulate matter. So all the ophthalmic products should be clear and free from foreign particles, fibers and the filaments. Okay, our ophthalmic preparations should be free from foreign particles, or they should not contain any type of foreign particles, fibers or the filaments. Again, ophthalmic solution should be clarified very carefully by passing through bacteria-proof filters such as membrane filters and the sintered glass filter. Okay, to remove the foreign particles, to remove the filaments or the fibers or the bacteria from ophthalmic preparation, they should be clarified or filtered through the different types of bacteria-proof filters or the different types of membrane filters. So the clarification or the filtration should be done carefully to remove all these contaminants. Again, the particle size of the eye suspension should be in an ultra fine state of subdivision to minimize the irritation. Okay, the drugs which are insoluble in the vehicles which are used for the ophthalmic preparation, for that drugs the suspensions are prepared, and in that case the particle size of drug which is incorporated in the suspension should be ultra fine, or it should not cause any irritation to the eyes after their installation. Again, the separate filter should be used for different ophthalmic products in order to avoid the contamination. Okay. After every batch, the filters are changed to avoid the contamination of different ophthalmic preparations. Okay, so in that main is what our ophthalmic preparation should be clear and they should be free from foreign particles, and for that the filtration is done by using different bacteria proof filters or the sintered glass filters of the different grades. Again, for ophthalmic suspension, the particle size of drug in suspension should be ultra fine, which can be tolerated by the eyes, and while doing the filtration of ophthalmic preparation, the filter is changed after intervals to avoid the contamination of subsequent batches. Okay, so this is the first characteristic, or this is the first need, that is ophthalmic preparation should be free from foreign particles. Then second one is the viscosity of ophthalmic preparation. So in order to prolong the contact time of the drug in the eye, various thickening agents are added in the ophthalmic preparation. Okay, after installation of eye drops or any other lotions or liquid ophthalmic preparation, as the surface of eye is the smaller, the eye drops or the eye lotion easily get overflowed from the eyes. Okay, so that what happens, the drug get washed out and the contact time of that drug is minimized. Okay, so to prolong the contact time of that drug with eyes, the viscosity of ophthalmic preparation should be higher. Okay, so to increase the viscosity, different thickening agents are added. Okay, so that thickening agents, what they does, they increases the thickness of vehicle so that the viscosity of liquid ophthalmic preparation get increase. Okay, so मेन पर्पज काय आहे विस्कोसिटीचा? ऑप्थॅल्मिक प्रिपरेशनमधल्या ड्रगचा आणि आपल्या आईचा कॉन्टॅक्ट टाईम इन्क्रीज करण्यासाठी किंवा ते ड्रग आईच्या कॉन्टॅक्टमध्ये जास्त वेळ राहण्यासाठी आपण काय करतो आहे, ऑप्थॅल्मिक प्रिपरेशनची विस्कॉसिटी इन्क्रीज करतो आहे. विस्कॉसिटी इन्क्रीज केल्यामुळे काय होणार, जे काही आय ड्रॉप्स आहेत किंवा आय लोशन्स ते इझिली वॉशआउट होणार नाहीत. ओके, आणि आपलं ड्रग हे जास्त काळासाठी आपल्या आईच्या कॉन्टॅक्टमध्ये राहू शकतं फॉर द बेटर थेराप्युटिक ॲक्शन. So different thickening agents like polyvinyl alcohol, which is used in the concentration of 1 to 4% as per the requirement. Then polyethylene glycol, then methyl cellulose, carboxymethyl cellulose are some of the commonly used thickening agents. So these different agents improves the viscosity of our liquid ophthalmic preparations. Again, an ideal thickening agent should possess the following properties like it should be easy to filter. Okay, it should not cause blocking of the filter, that is all the thickening agents should get filtered easily. Then it should be easy to sterilize. Again, it should be compatible with the other ingredients. And they should possess the requisite refractive index and the clarity level. Okay. So जे कोणते आपण थिकनिंग एजंट्स यूज करतोय ते दे शुड बी इझी फॉर फिल्ट्रेशन, स्टरलायझेशन, दे शुड बी क्लिअर अँड दे शुड बी कंपॅटिबल विथ द अदर इन्ग्रेडियंट्स और ड्रग विच इज ॲडेड इन द ऑप्थॅल्मिक प्रिपरेशन. Again, the thickening agents are not generally included in the formulation of eye drops or eye lotion, which are required to be used during or after the surgery due to some possible adverse effect on the interior of the eyes. ओके, जे कोणते आय ड्रॉप्स किंवा आय लोशन हे आपल्याला सर्जरी करत असताना किंवा सर्जरी केल्यानंतर इमिजिएटली यूज करायचे आहेत, त्याच्यामध्ये जनरली थिकनिंग एजंट्स ॲड केले जात नाहीत किंवा त्यांची विस्कोसिटी ही जास्त इन्क्रीज करत नाही. का? बिकॉज टू अवॉइड द सम ॲडवर्स इफेक्ट ऑफ द ड्रग और ड्रग गेट directly entered in the interior parts of the eyes. Okay, so in that case, to avoid the adverse effect of drug, the contact time is not increased. In that case, the thickening agents are need not to be added in such eye drops or the eye lotion which are used during surgery or immediately after the surgery. Okay, so basically thickening agents are added to improve or to increase the viscosity of eye drops and eye lotion. And why it is done? To improve the contact time of drug with the eyes. The next one is the tonicity. The ophthalmic product should be isotonic with the lacrimal secretion to avoid the discomfort and the irritation. Okay, as we said, as we studied that parental preparation should be isotonic with the different body fluids, like that our ophthalmic products should be isotonic with the lacrimal secretion. Otherwise, if the ophthalmic products are hypertonic or hypotonic, then they may cause the irritation or discomfort of the eyes. So it has been observed that eye can tolerate a range of tonicity from 0.5 to 2% NaCl. So there are certain isotonic vehicles which are used to prepare the ophthalmic products, like 1.9% boric acid, sodium acid phosphate buffer. Okay, our eyes can tolerate the tonicity from 0.5 to 2%, which can be adjusted with the help of NaCl, boric acid, or the sodium acid buffer, sodium acid phosphate buffer. The next one is the pH of the preparation. So pH plays an important role in the therapeutic activity, solubility, stability, and the comfort to the patient. Our drug shows the different solubility at the different pH, then stability at the different pH. Okay, so again the therapeutic activity at the different pH. Okay, so according to need of drug, first the pH of preparation is adjusted, and again pH is adjusted at which the patient can also feel the comfortable, or it should not cause any irritation to the eyes. Again the tear have a pH of about 7.4, so eyes can tolerate solution having the wide range of pH provided they are not strongly buffered, since the tear will rapidly restore the normal pH value of the eyes. The pH of tear is about 7.4. Again the alkaloid salt solutions are stable at pH of 2 to 3, but this pH is irritant to the eyes. Okay, certain drugs which are stable at low pH about 2 to 3, if such preparations are buffered at the pH of 2 to 3, then it can cause irritation to the eyes, because normally the pH of tear is the 7.4. So in that case there should be ophthalmic preparation should be buffered in the range of 7 to 8. So the alkaloids get precipitated at the pH above 7 and creates a number of formulation problem. Okay, certain alkaloid salt जे काही आहेत ते 2 to 3 pH ला स्टेबल आहेत, पण जर का आपण फॉर्म्युलेशनचा pH 2 to 3 ॲडजस्ट केला तर काय होऊ शकतं, त्या pHला फॉर्म्युलेशन जर का असेल तर ते आपल्या आईजना इरिटेशन करू शकतं. ओके, आईची रिक्वायरमेंट काय आहे 7.4. ओके, 7 to 7.4. पण जर का त्या अल्कलॉइड सॉल्ट असणाऱ्या pHचा फॉर्म्युलेशनचा pH जर का आपण 7 ॲडजस्ट केला तर काय होतं आहे, 7 pHला आपलं ड्रग प्रेसिपिटेट होतं आहे, म्हणजेच काय त्याच्यामध्ये फॉर्म्युलेशन करत असताना प्रॉब्लेम्स येतात. ओके, so to avoid all these problems, ophthalmic preparation should be properly buffered. The most important need is the sterility. The ophthalmic preparation must be sterile when prepared, and the sterility is maintained during the use of ophthalmic preparations also. Particularly the Pseudomonas aeruginosa is a very common gram-negative bacteria which is generally found to be present in the ophthalmic product, and it may cause serious infections of the cornea, and it can cause the complete loss of eyesight in 24 to 48 hours. Okay, Pseudomonas aeruginosa is a gram-negative bacteria. Generally, this bacteria is found in the ophthalmic product, and if such ophthalmic product is used by the patient, then what happens? it can cause the serious infection of cornea when the cornea get damaged, okay, or it can cause the complete loss of eyesight in 24 to 48 hours, okay. So to avoid such adverse consequences, our ophthalmic product should be sterile. So to maintain the sterility in multi-dose container containing the ophthalmic product, a suitable preservative is added, and the preservative should be non-toxic, non-irritant, and should be compatible with the medicaments, and the ophthalmic products are generally sterilized by autoclaving, filtration through bacteria-proof filters, and addition of bactericides at the low temperature, okay. So different preservatives or antibacterial agents, bactericidal agents are added to maintain the sterility of the ophthalmic preparations. The next one is the surface activity. The vehicles used in the ophthalmic preparation must have the good wetting ability to penetrate the cornea and other tissues. So the certain surfactants or wetting agents are added which are found suitable for ophthalmic product. So to improve the wetting ability of preparation, or for the easy penetration of certain drugs in the cornea and other tissues, the surface activity of drug is need to be improved, or wetting ability of drug is improved by adding different surfactants or the wetting agents which reduces the surface tension. So it should not cause any damage to the tissue of eyes. The different surfactants or wetting agents which are used, they should not cause damage to the tissue of eyes. So surface active agents like polysorbate 20, polysorbate 80, dioctyl sodium sulfosuccinate are used. One mistake is there, okay. Benzalkonium chloride is a preservative which is added in the ophthalmic preparation, and all other are the surfactants or wetting agents. So these are the general requirements of ophthalmic preparation. Once I will revise. First thing is, our ophthalmic preparation should be free from foreign particles. For that the filtration is done. Again, ophthalmic preparation should have adequate viscosity to improve the contact time of the drug with the eyes. Then ophthalmic preparation should be isotonic with the lacrimal secretions to avoid the discomfort or irritation of eyes, and tonicity is adjusted by using NaCl or the boric acid or sodium phosphate buffer. Then pH of preparations. pH of tear is a 7.4, so all the preparations are buffered at the pH of 7 to 7.4, again by using the sodium phosphate buffer. Then sterility, ophthalmic preparation should be sterile. So to maintain the sterility, different preservatives or bactericidal agents are added. Okay, benzalkonium is widely used in the ophthalmic preparation. Then surface activity, to improve the wettability of drug, the different surface active agents or wetting agents are added. So these are the general requirements of all ophthalmic preparations. Again, this point is important as per the exam point of view. In many exams they are asked that Write down the general requirements of the ophthalmic preparation. So you have to write all these 6 requirements. The next one is we have to study the formulation of different ophthalmic preparation, that we will start in the next lecture. In that we will see the formulations of eye drop, eye lotions, eye ointments, eye suspension, and the contact lens solution. Okay, so for any query please ask to me, and thank you for your attention.